Welcome back to the deep dive. Today we are cracking open a tiny vitamin with some massive, really fundamental responsibilities, vitamin B12.
Mm,
And we're not just talking about generalized energy. We mean the literal, well, the integrity of your body's communication networks
wow,
and how your most essential cells get built.
that's right.
And here's the fact that really kicked off this deep dive for us. Sources suggest that up to, well, maybe 1 in 4 people, sometimes even 1 in 10, actually have a B12 deficiency.
Wow, that's a lot.
It is, and often without realizing it at all, the data shows this rate is particularly noticeable in certain areas,
Yeah.
like parts of Latin America.
Yeah.
It just highlights how sensitive getting this vitamin actually is to diet and health factors around the world.
Yeah, absolutely.
So our mission today is to dive into the sources, really unpack this essential micronutrient. We want to explore exactly how B12 acts as the body's essential insulator and what those strange, almost slow-motion symptoms of a deficit look like. And critically, who's most vulnerable because of, modern prescriptions, certain diets, or even just getting older?
And what's fascinating, I think, is understanding why that deficiency is often such a slow-moving target at first.
Right.
Like you said, B12 is absolutely vital, really key for two major systems. The nervous system, so the brain and all its connections, and the circulatory system, specifically making good quality blood cells.
Okay, 2 big ones.
Huge. But the body, it has this massive failsafe built in. Your liver holds truly enormous reserves of B12.
How much are we talking?
We're talking maybe 1,000 to 2,000 times the amount you actually need each day, which is tiny, only about 2 to 4 micrograms.
Whoa.
Yeah. So because you have this enormous storage tank, symptoms of not getting enough or not absorbing it well usually only show up maybe 3 to 5 years later, once those reserves are basically gone.
Wait, hang on. So we could be, silently running down this tank for years. Maybe we change our diet or start a new medication, and the clock on actual physical symptoms doesn't really start ticking for half a decade.
That's often the case, yeah.
That means when the symptoms do finally show up, the damage could already be pretty severe and long-standing. That sounds like a genuine nutrient time bomb.
It really does, and it makes diagnosis incredibly tricky, because the patient hardly ever connects their current fatigue or maybe some weird nerve thing back to something that changed years before.
Okay, let's unpack that core function then, starting with the nervous system. You mentioned the brain and connections. I like that analogy people use. Neurons are like little electricity factories. They send signals through these long, sometimes meter-long cables called axons.
Right, incredible structures.
Now, if you think about, say, a high-speed internet cable, it needs perfect insulation, doesn't it?
Absolutely.
That's where B12 comes in. It's like the master architect for creating myelin.
Okay, myelin.
Yeah, myelin is this protective sheath made of fat and protein that coats these nerve cables. It acts as an insulator, helps conduct the signal, and protects the cable all at once.
Yeah.
So basically make sure those electrical signals travel super fast and efficiently to your muscles, your heart, your glands, everywhere.
Got it. Like the rubber coating on an electrical wire.
Exactly. So if you have a deficit, the body just can't generate enough of this protective myelin. The signals get messed up, the cables sort of fray, you could say.
Okay.
And that leads directly to those neurological symptoms we need to talk about.
That's a great way to put it, the fraying cable. But while B12 is busy, or failing, to insulate our nerves, we have to remember it's doing something else in parallel, right? At that really fundamental DNA level.
Yes. What's happened there?
Well, B12 is absolutely fundamental for making DNA correctly. And DNA, of course, governs how cells divide.
Right.
So think about red blood cells, white blood cells. They're constantly being made in the bone marrow. If B12 is missing, that crucial DNA building process gets altered.
How so?
It leads to a condition called megaloblastic anemia.
Megaloblastic. That sounds serious.
It is. So instead of making good quality, tough little blood cells, the whole process breaks down.
What happens to the cells?
Well, instead of being small, mature, and really flexible, which they desperately need to be, to squeeze through tiny capillaries delivering oxygen.
Right, those tiny little vessels.
Exactly. The red blood cells come out defective. They're actually too large, which is where the name megaloblastic comes from.
Mega means big. Okay.
Yep. And they're less flexible. And critically, they also just don't live as long as healthy cells. Normal red blood cells live about 120 days, these ones. They get destroyed much earlier, sometimes even in the bone marrow itself.
So that leads to widespread oxygen delivery problems and anemia.
Precisely. Widespread issues.
Okay, this is where it gets really important for anyone listening. The symptoms. They're much more specific and, frankly, weirder than just feeling a bit tired.
Definitely.
Let's dive into those neurological alarms first, the ones that signal actual nerve damage from that missing myelin. These are the signs you really want to watch out for.
Okay.
We're talking about strange neurogenic pain, often in the tips of the fingers and toes.
And what does that feel like?
It's not like muscle soreness. People describe it as like burning or stabbing or just a really uncomfortable, weird sensation. Then there's paresthesias, that classic tingling or prickling, the pins and needles feeling, usually in hands and feet.
The pins and needles, very common sign.
And what's really fascinating are the signs that point directly back to that damaged myelin sheath on the nerve cables. The sources mentioned a couple of really specific, startling ones.
Like what?
First, patients often report losing the ability for their skin to feel vibration.
Huh. Vibration sense. That's specific.
Isn't it? And second, there's something called Lhermitte's sign.
Lhermitte's.
Tell me about that.
Apparently, you just bend your neck forward, tilt your head down, and you feel this electric shock zap down your body.
Wow. Just from moving your head. Yeah. It's such a specific, almost unbelievable sign of myelin damage running down the spinal cord. It sounds, well, terrifying, frankly.
It really highlights how serious the underlying structural damage can be. And then, of course, we see the more typical signs of severe neurological problems progressing. Numbness, maybe losing your balance, walking strangely, even falls.
Right.
Plus those behavioral changes you sometimes see. Irritability, maybe depression, and that just relentless extreme tiredness that goes beyond normal fatigue.
Okay, let's switch gears to the blood-related symptoms now, that megaloblastic anemia you mentioned.
Yeah.
Obviously, that leads to pallor, right? Looking noticeably pale or sort of whitish.
Yes, that's a classic sign. And of course, persistent fatigue.
And you mentioned the body destroying those defective red blood cells early. Does that cause other issues?
Well, yes, in some, usually rarer cases, the body's effort to clear out all those broken down red blood cells has a side effect. When the cells break, they release a lot of hemoglobin. That gets converted into something called bilirubin. If you get too much bilirubin building up, it can cause jaundice.
Jaundice, like yellowing.
Exactly. The sources specifically mention a lemon-type yellowing of the skin and the sclera, that's the white part of the eye. It's a very specific, kind of unique color that's linked directly to how that specific type of anemia works.
Huh. Lemon yellow. Okay.
Yeah.
And we can't forget the mouth, right? There was a classic sign there, too.
Oh, yes. Glossitis.
Glossitis.
Yeah, basically the tongue loses its little bumps, the papillae that give it texture. It becomes intensely red, often sore, and noticeably smooth. Almost looks slick.
Wow. Smooth, red, painful tongue.
And the sneaky thing about that tongue symptom is the link to taste.
How so?
Patients can actually lose or have a decreased sense of taste. But because the whole deficiency develops so incredibly slowly, over years sometimes, they often don't even notice the change. Not until maybe they realize they suddenly need way more salt or spice on their food than they used to.
That's subtle. You might just think your tastes are changing. Exactly. And finally, the sources mentioned some other, maybe less common, systemic issues linked to the anemia, like palpitations.
Yes, feeling like your heart is beating too hard or irregularly. And critically, there's also a suggested link, particularly in severe untreated cases, between the anemia and possible infertility or sterility issues.
Okay, so the damage is clearly severe. It's progressive. But the root cause, you're saying, is often not just low intake of B12, but a failure in actually absorbing it.
That's a huge part of the puzzle, yes.
Which brings up the question, why is B12 absorption so darn complicated that so many people seem to have trouble with it?
It really is an elaborate multi-step process. You have to remember, B12 that you get from animal foods, it's initially locked down tight. It's bound to proteins in the food.
Okay, so it's not just floating free.
Not at all. To get into your body, B12 basically needs like a secret handshake, a special driver, and it has to go through a specific VIP entrance.
Huh. A secret handshake. I like that.
It helps picture it. Let's break down that mechanism. There are 3 absolutely essential steps. Step 1 happens right away in the stomach.
Okay.
Your stomach must be highly acidic. That strong acid is needed to basically dissolve the bond and separate the B12 from those food proteins it arrived with.
So high acid needed first, step 1.
Step 1. Then step 2. Once the B12 is finally free, it has to immediately grab onto another crucial protein. This one's made right there in the stomach lining, and it's called intrinsic factor.
Intrinsic factor. Okay, what does that do?
That's the special driver. It's the key. Without binding to intrinsic factor, the B12 is basically useless. It can't get absorbed.
Got it. Acid frees it, intrinsic factor binds it. What's step 3?
Step 3. The B12, now perfectly bound to its driver, intrinsic factor, travels down, and it can only be absorbed in one tiny, highly specialized part of the small intestine, way down at the end, in the distal ileum. That's the VIP entrance.
The distal ileum.
Sure. If any one of those three steps fails, not enough acid, not enough intrinsic factor, or a problem at that absorption site, you could eat a steak full of B12 and it just won't get in.
Wow. Okay, that three-step mechanism immediately explains why so many different groups of people are at risk, even if they eat meat or dairy.
Exactly.
Let's use that framework. Who are the high-risk groups then?
Okay, let's think about steps 1 and 2. First, the stomach acid and the intrinsic factor.
Right.
Well, people over 50 or 60 are naturally more at risk. Why? Because as we age, we tend to produce less stomach acid. And we're also more prone to getting gastritis, which is inflammation of the stomach lining. That can reduce both acid and the production of that crucial intrinsic factor.
Makes sense. So following that logic, what about people taking antacid medications, like those purple pills for heartburn?
Huge risk factor. They are literally taking medication designed to lower stomach acidity. So they're directly blocking step 1, preventing B12 from separating from the food proteins in the first place. If you rely on antacids regularly, this is a serious flag, something you should definitely discuss with your doctor because you're actively messing with this process.
Okay, good to know. What about diabetics or pre-diabetics? I read something about metformin.
Yes, that's a critical one. Metformin is a very common medication, widely prescribed for blood sugar control, but it's known to interfere directly with B12 absorption somehow.
So people on metformin long-term really need to be aware.
Absolutely. Supplementation is often recommended for long-term users. Definitely something to manage with their doctor.
Okay, now let's think about step 3, that specific absorption site, the distal ileum. Who might have problems there?
Surgery patients come to mind immediately. Anyone who's had surgery on their stomach or, crucially, their small intestine.
Like weight loss surgery, maybe? Or other procedures?
Exactly. Especially if parts of the distal ileum were removed or significantly altered, they might simply lack the necessary absorption site, or perhaps the surgery affected intrinsic factor production higher up. Either way, it puts them at a high, often lifelong risk.
And related to intestinal issues, what about inflammatory conditions?
Good point. Conditions like celiac disease or Crohn's disease, they cause chronic inflammation and damage to the intestines, right where B12 needs to be absorbed, so they can definitely disrupt that final absorption phase in the ileum.
Makes sense. And then, of course, the most direct reason for low B12, low intake, vegans and vegetarians.
Right. Since B12 is primarily found in animal products because it's stored in animals' tissues, especially the liver people avoiding those foods lack the main dietary source.
So they absolutely must supplement or really focus on fortified foods.
Yes, absolutely. A plant-based diet can be perfectly healthy. We fully support that, but it must be, let's say, responsibly programmed. You have to consciously include a reliable B12 source, whether supplements or fortified foods, to avoid deficiency. It's non-negotiable.
Okay. And one more group. Pregnant and nursing mothers.
Yes, their needs go up quite a bit. Daily requirements increase maybe to 2.6 or 2.8 micrograms a day.
So they can burn through their reserves faster.
Much faster. They can deplete those deep liver reserves rapidly. And here's the crucial part. Even if the mother isn't showing severe symptoms herself yet, she might risk not passing enough B12 on to her baby through pregnancy or breast milk.
And that's critical for the baby's developing brain and nervous system.
Extremely critical, especially during that rapid growth phase.
Okay. Since prevention is clearly way better than dealing with nerve damage, let's talk food sources quickly.
Sure. As we said, B12 is primarily in animal products, meat, all types, fish, poultry, eggs, dairy. They all contain it.
Is there a best source?
Well, if you want the absolute highest concentration, liver is usually at the top. Because that's where animals store B12, so it's incredibly nutrient-dense in that respect.
Got it. And for those on non-animal diets, what's the key?
Consistency, either with fortified foods or supplements. B12 is notoriously hard to find naturally in plants in reliable amounts. So look for things like breakfast cereals, plant milks, or especially nutritional yeasts that have been fortified with B12.
Nutritional yeast, right? Some vegans use that a lot.
Yes, often fortified. Or simply use a reliable B12 supplement. The core message really is, if you're cutting out animal products, B12 supplementation isn't optional, it's a priority to stay healthy.
Okay, so what does this all mean in terms of taking action? If someone listening recognizes some of those risk factors we just went through, and they're noticing any of those weird specific symptoms, the tingling, the nerve pain, that strange fatigue, maybe the smooth tongue, what should they do?
First up, consult your doctor. Don't self-diagnose based on this.
Right.
But specifically ask them to test your B12 levels, and maybe even its metabolite.
Metabolites, what does that mean?
Good question. Metabolites are basically the substances that B12 breaks down into or helps create as it does its job in your cells. Testing these can sometimes give a clearer picture of whether the B12 you do have is actually functioning properly inside your cells, not just how much is floating around in your blood serum. It adds more detail.
Okay, so ask for B12 and maybe metabolite testing. Now, what about treatment? Does it vary?
It definitely varies depending on how severe the deficiency is and what the root cause seems to be. For people with really severe neurological symptoms, doctors often jump straight to injections.
Injections, like intravenous or into the muscle?
Usually intramuscular, yeah. And there's a really important reason why injections often work so much better than just telling someone to take massive B12 pills.
Okay, why is that? Because it seems counterintuitive, maybe.
It goes back to that whole absorption mechanism we talked about.
The acid, the intrinsic factor, the special site.
Exactly. Injections completely bypass that entire complicated digestive process. They skip the need for stomach acid, they skip the need for intrinsic factor, that special driver, and they skip that limited absorption bottleneck in the ileum.
So they bypass the whole secret handshake VIP entrance system.
Precisely. They deliver the B12 directly into your system where it can be used immediately. See, if you take oral supplements, even really high doses, they still have to go through that process. And the intrinsic factor protein, it has very limited capacity. Think of it like a ferry with only a few spots.
Okay.
It can only shuttle so much B12 across at one time. So even if you swallow hundreds of times the daily need, only a tiny fraction actually gets absorbed.
So injections guarantee a large amount gets in quickly to stop the damage.
Exactly. It ensures a massive amount is immediately available, which can be crucial for halting progressive neurological damage faster.
That makes perfect sense now.
Uh-huh.
Okay, so the core message seems to be whether your diet includes meat or it's a responsibly planned plant-based one, healthy intake, and crucially, functional absorption are the keys to prevention.
That's the bottom line.
B12 really is the myelin architect and the DNA facilitator.
Couldn't have said it better. But maybe let's leave our listeners with one final thought to chew on. Connecting back to that slow burn progressive nature of the deficiency,
Okay.
we know B12 deficiency leads to megaloblastic anemia because it messes up DNA generation and cell division, like the most fundamental mechanics of life, right?
Right.
And we know the symptoms are often delayed for years because of those liver reserves. So how might this slow progressive impact on basic cellular function influence other long-term health outcomes that we maybe don't obviously connect to B12?
What do you mean?
Well, we often attribute various declines simply to aging, but could years and years of slightly suboptimal B12 processing, maybe not full-blown deficiency, but just not quite optimal, could that actually be driving other seemingly unrelated chronic issues? Does it demand we think much more proactively about ensuring we have enough of this essential insulator, not just waiting for obvious symptoms?
That's a provocative thought. What else might be quietly affected by years of suboptimal cellular mechanics driven by low B12? Definitely something to think about.